my name is Alana. I'm going to be your nurse practitioner doing your full physical exam today. I'm going to start by examining your head. I'm going to look at your scalp for any unevenness, bumps, or lesions. Okay, now I'm going to start by, I'm going to assess your submandibular joint. Open your mouth, now close. Okay, no clicks, any pain?
No.
Okay, I'm going to do your cranial nerves. I'll have you raise your eyebrows. Okay, now close your eyes tight. Make a frown. Okay, you can open your eyes. Now puff your cheeks out. Okay, relax. And this is called the cotton whiff test. I'm going to have you close your eyes when you feel it on your facing now, okay?
Yeah. Yes. Yes. Yes.
Okay, I'm going to assess some of your lymph nodes. I'm going to do your preauricular, your postauricular, your submental, mandibular, your subclavicular, your occipital. Okay, I'm going to do your eye exam. Okay, first I'm going to have you cover your right eye. No, sorry. Can you take this off? Okay, I'm going to have you follow my finger. Okay, come up. Okay, very good. Okay, I'm going to dim the lights. I'm going to have you cover your right eye. And then assess for the pupil getting smaller. Okay, now cover your left eye. Same thing. Okay, now I'm going to do it again and watch the other eye. See for a combination. Good. Now I'm going to assess some of the inner structures of your eye. Go medially for the cup and the disc, laterally for the macula and fovea. See the red light reflex. Same thing on your right eye. Medially for the cup and the disc, laterally macula and fovea. I saw the red light reflex. Okay, now we're going to do an assessment of your ears. Do you have any pain or discomfort? Okay, this is called the whisper test. I'm going to whisper 3 words in your ear. Repeat after me, okay?
Book, chair, couch. Table, pillow, blanket.
Okay. Now I'm going to take a look at the inner structures of your ear. I'm going to pull up, back, and out. Okay. Tympanic membrane intact. Pearly gray, no cerumen. Same thing on the other side. Pull up, back, and out. Pearly gray. Tympanic membrane intact. No cerumen. Okay. Now I'm going to assess your nose. I'm going to occlude one side and have you sniff. Okay, other side sniff. Okay. Now I'm going to have you tilt your head up and take a look inside your mouth. Your nose.
Oh.
Okay, the turbinates are not red or inflamed. Okay, and then I'm going to have assess your mouth, do a big smile. Okay. Relax. Okay. Gums are intact, not inflamed or red. I'm going to have you stick your tongue out. Stick your tongue out. Gag reflex, okay. And one more thing for the cranial nerves. I'm going to have you shrug your shoulders. Okay, good. Now I'm going to take a look at your neck. No tracheal deviation observed. And then you hold this. And I'm going to have you push the trachea to the left, tilt your head to the right a little. Okay, now take a sip of water. Okay. to assess your chest. I see you have a 2 to 1 AP diameter.
What's that?
I'm going to have you do a deep inhale and exhale every time I move position through your mouth, okay? Okay, the same thing on your back. Just move this way a little bit. Okay. And what I was supposed to do before that stuff was percuss your chest, so. Face this way. Okay, now we're gonna assess your heart.
Didn't do that yet.
Okay. Apical side. Pulmonic. Herbs point. Tricuspid. And mitral. Same thing with the bell. Oh, no, I'm sorry, I'm gonna have you lay down.
Lay
Back.
down.
That's fine. Okay, I'm gonna have you lay on the couch. Okay.
Oh, I'm gonna put my head down.
I'm gonna do the abdominal assessment now. I'm going to first inspect your abdomen. Okay, now I'm going to auscultate at all 4 quadrants. Okay, now I'm going to percuss in all 4 quadrants. Okay, now I'm going to palpate in all 4 quadrants, light, and then deep. And now I'm going to go up for the liver border, right under the last rib. Take an inhale. And exhale. Okay. Okay, now I'm going to do your vascular assessment. I'm going to look at both of your upper extremities for color, feel for temperature, I'm going to feel the radial pulses. The brachial, then radial. Same thing with your legs. I'm going to feel for temperature. Observe. I'm going to feel down the tibia for edema. Okay, I'm going to feel for the femoral pulse. Bend at a 30-degree angle for the popliteal pulses. And okay, and I'm going to do the cap refill. Okay, now for the final part, I'm going to have you stand up. And I'm going to have you bend forward. Okay, I'm going to observe that the spine is straight. Okay, now I'm going to have you face me. Put your hands on your hips. I'm going to have you twist right to left. Okay, now bend right and left. Okay, great. Thank you.